Hey guys, it's your favorite medical channel Medicosis Perfectionalis, which sounds exactly like Pneumatosis Intestinalis. In the previous videos we have discussed osteoarthritis in my great playlist about rheumatology. Today we'll talk about rheumatoid arthritis, the inflammatory arthritis, where you have rheumatoid factor, which is an antibody against an antibody, an IgM against the Fc portion of an IgG. It's like a dog chasing its tail. Rheumatoid arthritis will have elevated ESR and CRP. Watch my video on these topics. And here is my caricature of a rheumatoid arthritis patient, and her name is Rose, and she has rheumatoid. So here just a sample of my previous rheumatology videos, so please subscribe and save this playlist. My videos are to be viewed in order to understand this current video. If you don't have time, at least watch number 3. Watch ESR and CRP, acute phase reactants, rheumatoid factor and anti-CCP, and of course osteo. Every single week you can get a case plus answer plus explanation sent directly to your email inbox. Just go to patreon.com/medicosis and follow me there. It's free. I'm an old guy in my mid-20s, so I remember back in the day when the bubonic plague and cholera were the big thing that killed millions of people. I remember when leprosy used to deform bones. I recall when tertiary syphilis used to destroy brains and aortas. I recollect when the father was clueless and hopeless at his 21-year-old son, harshly vomiting every drop because of the nasty Vibrio cholera. I remember when the mother was weeping because her 19-year-old daughter died from septicemia during childbirth. I also remember when Anthony van Leeuwenhoek, Louis Pasteur, and Joseph Lester taught us that microorganisms do exist and they can cause disease. And I remember waking up to the news that Alexander Fleming, the Scottish scientist who lives in London, discovered penicillin as an antibiotic by chance. He was a lazy guy, bored out of his God-given mind, and said, you know what, I'm gonna go on vacation, screw this lab work, I'm sick and tired of being sick and tired. He left his petri dish full of staff on the table, forgot to shut the window because he was so lazy, exited the lab safely, went to vacation, had a great time with the wifey, and then returned back to the lab, only to discover that part of the petri dish is now empty of bacteria. The staphylococci just disappeared. What? Is that even possible? How did it happen? And then he discovered that some fungus had entered through the window, jumped over the chair, below the shelf, and into the petri dish, destroying the ugly staph. The name of the fungus? Penicillium notatum. And penicillin was born. Voila! And from the time on, London talked about nothing else. 5 o'clock tea time became penicillin time. Starbucks introduced penicillinicino. 1 venti cup that's fresh, and you have no staph on your dish. Yeah, the last part was sarcasm. Some people might say, Fleming was just lucky. But you forgot that the harder I work, the luckier I get. The discovery of penicillin was on the morning of Friday, 28 September 1928, when dinosaurs walked the back of the earth. Less than 100 years ago, penicillin opened a new era of miraculous class of drugs called antibiotics, and turned the page on an old era, the era of the Black Death, the leprosy, the cholera, the typhus, the syphilis, and many other diseases. But antibiotics are bad. Shut up, read history. Antibiotics are horrible. Wah! Call the wambulance and cry me a river and give me a break. Antibiotics have side effects, yup. And drinking water too much has side effects. Riding a bicycle too much can be bad for your testes. Everything in life has desired effects and adverse effects. Wisdom is to balance the risk versus the benefits, the advantages versus the drawbacks, the pros versus the cons. Ignorance is to just shout out antibiotics are terrible, the pharmaceutical companies are killing us. And as the famous economist Dr. Thomas Sowell said, in life there are no solutions, there are only trade-offs. Thanks to antibiotics, people started living longer instead of dying in their 30s. And when people live longer, the diseases of the elderly become commoner. Diseases such as Alzheimer's, dementia, endometrial cancer, prostate cancer, colon cancer, as well as rheumatological conditions such as rheumatoid arthritis, which is today's topic. While penicillin was the blockbuster back in the day, today's battle is all about chemotherapy and the biological DMARDs. And what makes cancer and rheumatological disease similar is, number one, we don't know what really causes them. However, we have some interesting theories because we are super sophisticated to the point of being stupid. That's why we call them idiopathic, which means we are idiots and we can figure out the pathology. 2. There seems to be a genetic component in both. 3. There seems to be an autoimmune component in both. 4. Both are chronic diseases. 5. Drugs that seem to treat one can treat the other. Example, methotrexate is a chemotherapeutic agent that treats cancer, and it's also a synthetic DMARD that can treat rheumatoid arthritis. Rituximab is an immunosuppressant that treats non-Hodgkin's lymphoma, and it can also treat the rheumatoid arthritis, which increases your risk of lymphoma. Same thing as Sjogren syndrome. Why is rituximab good for B-cell lymphoma? Because it's a monoclonal antibody against CD20. And believe it or not, the B lymphocytes are CD20 positive. Rituximab will destroy them. Therefore, it's good for B-cell lymphoma, called common sense. Why is rituximab good for rheumatological diseases or autoimmune diseases? Okay, where do you think the O2 antibodies come from? From the B lymphocytes. And rituximab is anti-B lymphocytes, called common sense. And people are shocked. Can you believe it? Can you believe that rituximab improved the rheumatoid symptoms in this patient? Of course I can believe it, because I've studied physiology in first year med school. Hello. It's like that new study that shows that drinking very hot tea for a long period of time increases your risk of esophageal cancer. And people are shocked. Oh my goodness, can you believe it? Of course. Any repetitive trauma to any tissue for a long period of time increases your risk of cancer. Pathologists have known this fact for over 40 years, and it was written in your pathology textbook, but you have sold it on eBay for pennies on the dollar. And yet, people go to Starbucks and order the venti soy macchiato with mocha drizzle and are terrified that they will get esophageal cancer. Chill your butt down. You go to Starbucks, you wait for 10 minutes until the barista milks the cow, brews the coffee, pour the coffee into the venti cup, add some milk and espresso on the top, mix it with honey, drizzle it with mocha, and sprinkle it with cascara, spray it with cinnamon, and top it with whipped cream with nitro cold brew. Charges you $10.95 because you're stupid, and then calls your name, and then you come forward, penetrating your way through the masses to catch your glorious cup of coffee. So by the time you do that, the coffee is not that hot, so you're fine. There is nothing to panic about. You need to chill, okay? Also, I'm not giving you any medical advice. Please talk to your doctor. This was a profound introduction, real education, actual medical facts, not your broke brother-in-law with an opinion, not your miserable pharmacology professor with some interesting theories, not a news reporter on TV with a political agenda, and for sure as heck, not the online sales guru with his natural juice cleanser detox. Now let's get started. Rheumatological diseases are divided into monoarticular, oligoarticular, and poly. If you remember osteo with mono or oligo. Rheumatoid arthritis is polyarthritis. Now to be clear, rheumatoid can start as mono, oligo, or poly, but the advanced disease is almost always poly. You can also divide joint diseases into non-inflammatory, inflammatory, septic, and hemorrhagic. Rheumatoid arthritis is here, inflammatory arthritis. As you know, arthritis is divided into non-inflammatory such as osteo and inflammatory such as rheumatoid arthritis. Don't be fooled by osteoarthritis, it's non-inflammatory. If you really understand that rheumatoid arthritis is inflammatory, everything in this video and in the upcoming videos is going to be a piece of cake. Rheumatoid arthritis involves the wrists and the metacarpophalangeal joints. If you divide arthritis into acute and chronic, rheumatoid arthritis is chronic, 100%. In fact, you need to have symptoms for more than 6 weeks in order to be diagnosed with rheumatoid arthritis. Arthritis can be divided into asymmetric and symmetric. Rheumatoid arthritis is symmetric. Why? Because it's an inflammatory autoimmune disease, and autoantibodies do not discriminate. They will affect the right knee and the left knee equally. They will affect the right wrist and the left wrist equally. Joint diseases are divided into axial and peripheral. What's your axis? It's the axis of your body, the vertebral column or the spine, such as degenerative disc disease and the spondyloarthropathy, such as ankylosing spondylitis. Peripheral can be big joints, such as osteoarthritis, or small joints, such as rheumatoid arthritis, which is today's topic. Please don't ever forget that axial means the spine. If you forget what's the axis, I'll come to your home and make you rotate around your axis until you never forget where your axis is. It's the axis of your body. It's the spine, honey. It's not the axis of your hand or something like that. We have talked about osteoarthritis before. You can check the previous videos. Rheumatoid is inflammatory. Therefore, you'll find cardinal signs of inflammation: redness, hotness, swelling, pain, loss of function. Rubor, calor, tumor, dull, functional, let's say. Symmetric. Again, autoantibodies do not discriminate. Worse in the morning. Why? Because as the day progresses with activity, you're washing out the inflammatory debris and your symptoms are going to improve. ESR and CRP are going to be high because it's an inflammatory arthritis. Also, ferritin can be high. Why ferritin? Because ferritin is an acute phase reactant, and I have a video about the acute phase reactant in this series. Also, platelets could be considered an acute phase reactant, so don't act as surprised if you find thrombocytosis in cases of rheumatoid arthritis. Let me remind you of osteo real quick. It's non-inflammatory, therefore no cardinal signs of inflammation, no constitutional symptoms. Joint pain worsens with use, therefore it's worse in the evening. It's asymmetric, no elevation of ESR or CRP. Osteo is non-inflammatory and it's biomechanical, therefore affects the big joints, the weight-bearing joints. Obesity is a risk factor. Trauma is a risk factor. Manual occupations, risk factor. Chronic disease, joint fluid analysis, less than 2,000. Predominantly lymphocytes. Morning stiffness for less than 30 minutes, no synovitis. Why? Because there is no inflammation. Perfectionist's Ultimate Notebook, plus 20 lymphoma cases, plus 25 bleeding cases, available at patreon.com/medicosis. Now let's talk about rheumatoid arthritis. It's autoimmune, it's chronic, it's a systemic inflammatory problem. Therefore, you will find cardinal signs of inflammation: redness, hotness, swelling, pain, loss of function. You will find constitutional symptoms: fever, weight loss, night sweats, etc. Joint pain that improves with use. So it's worse in the morning because as you move, you're washing out the inflammatory debris. It's symmetrical because autoantibodies do not discriminate. Elevation of ESR or CRP. And I've made a video about ESR before. I've made a video about CRP before. Rheumatoid is inflammatory, therefore affects small joints. Remember, osteo was big joints. Rheumatoid is small joints. Wrists, hands, feet. Commoner in females. Same as osteo. It's a chronic disease. Sometimes have acute flares. Joint fluid analysis will give you white blood cells that are more than 2,000, but less than 100,000. Some authors will say less than 50,000. I don't care. It's more than 2,000. That's all I care about right now. And it's not as high as septic arthritis. During those acute flares, you'll have predominantly neutrophils, PMNs, more than 50% of the white blood cell count inside the joint. So, if you tap the joint and aspire during an acute flare of rheumatoid, it's going to be predominantly neutrophils. What if we tap it during the chronic course? Why would you do that? The whole point of arthrocentesis is to diagnose a knee problem when you cannot figure it out by yourself. If I went to a doctor for a routine checkup with no symptoms and he said to me, "Son, your knee is normal. Let me tap it and aspire fluid," I would use my L3 and L4 segments to start a patellar reflex to kick him in the butt, called knee jerk reaction, because he is a jerk. Even my jokes have something to learn from. I like my educational jokes, which makes me a narcissist, which is a cluster B personality disorder. Anyways, since this is an inflammatory arthritis, you'll have morning stiffness for more than 30 minutes, even more than 1 hour. Why? Because in inflammatory arthritis, stiffness predominates, not the pain, but the stiffness. Since there is inflammation, therefore there is synovitis. And let me give you a pearl. Diseases of autoimmunity are commoner in women. Diseases of immunodeficiency are commoner in men. Boom! I've just saved you hours of studying. Look at this lady. Look at Rose, who has rheumatoid arthritis, and you will never forget that rheumatoid is commoner in women. Your hippocampus will thank me. Make it emotional to make your amygdala smile. That's how memory works. That's why you're able to memorize the movies, but not your textbook, because movies are emotional while the textbook is as cold as sin. That's why you're watching this, and I'm glad to have you. Welcome to the tribe. Now let's have some fun. This is rheumatoid arthritis. ASR is high, CRP is high, even ferritin is high, and platelet count can be high. What is the rheumatoid factor? IgM antibody against the Fc portion of IgG. An antibody against an antibody, like a dog chasing its tail, which is weird. That's the definition of disease. So we have white blood cells in the joint, and they are more than 2,000. This is inflammatory arthritis. Look at this lady. You have Baker's cyst, also known as popliteal cyst, on the back of the knee, and these can rupture, and it's horrible, and it can confuse you with DVT, because when it ruptures, or before even it ruptures, it can constrict veins from the outside. Ooh, so it looks like DVT, but it's not DVT. This lady has hepcidin. Hepcidin is wild. That's why she has anemia of chronic disease. And by the way, anemia of chronic disease is also known as anemia of inflammation. And rheumatoid arthritis is an inflammatory arthritis. Therefore, you'll find anemia of inflammation in inflammatory arthritis. Cool. What else? Those rheumatoid nodules are on the extensor surface. Why? Because they are more liable to trauma. Okay. Then you have the PIPs and the MCPs involved, as well as the wrist. Cool. You can have carpal tunnel syndrome. The median nerve is entrapped below the retinaculum, causing symptoms of motor symptoms and sensory symptoms. Rose, who has rheumatoid, can have pancarditis. So here is a heart with layers: endocardium, myocardium, and pericardium, but the most common is pericardium. Okay, then the lungs. You have basal fibrosis, and you can have rheumatoid nodules in the lung. If you look at her eyes, she's having scleritis and episcleritis, not uveitis. If you look at her cervical spine, she's having atlantoaxial subluxation, which could be an emergency. Be very, very careful before you perform an endotracheal intubation on a patient who has rheumatoid arthritis. You can literally kill them, or at the very least, make them quadriplegic, which makes you stupid. Don't do it. How do I know if she has atlantoaxial subluxation? You order an X-ray of the cervical spine with flexion and extension views. Next, look at her hair. It's not gray yet, and it's not that black either, because the typical age of presentation is between 40 and 50 years of age. Now, luckily, in these days, we do not see these deformities anymore. Why? Thanks to the biological DMARDs, disease-modifying anti-rheumatic drugs. Because everybody hates the big corporations. Just shut up. Big pharmaceutical corporations are like anything in life. Sometimes they do amazing stuff, and we should applaud them. We should be very happy and thank them. And sometimes they do stupid stuff, and we should punish them for it. Wisdom is to balance the risk and rewards, the pros and the cons. If you want more notes about rheumatoid arthritis, more than these videos, you go to patreon.com/medicosis. For just $1, you get lots of stuff about rheumatoid arthritis, and you even know about the likelihood ratio. And for that same $1, you get some notes about osteoarthritis, about aspirin, and many other stuff. If you love pictures and mnemonics, try Picmonic. See the link in the description. Thank you guys for watching. Please subscribe and join the tribe. Hit the bell to get notifications. Go to Facebook. I have more than 100 cases there. Follow me on all of these platforms. Go to patreon.com/medicosis to get all of my PDF notes that are downloadables, and you can save them offline forever. Thank you for watching. This is Medicosis Perfectionalis, where medicine makes perfect sense. As always, be safe, stay happy, and study hard.